There's no interest. Call or schedule your safe at home or virtual estimate at wallside.com.
Well, it is Breast Cancer Awareness Month, and this morning we are putting the spotlight on screenings.
Now, the pandemic isn't stopping breast cancer, and it shouldn't stop you from getting an exam.
One woman's story of survival captured our attention.
The 7 Action News reporter Jen joins us live from downtown Detroit with a look at how a self-exam saved a life amid an alarming trend. Jen?
Yeah, Keenan, Amira, you can't walk downtown Detroit during the month of October without constant reminders. You can see some of the buildings lit up pink behind me that it is Breast Cancer Awareness Month. And for many of us during the pandemic, the hospital or even a doctor's office is maybe not your favorite place to be right now. But doctors say missing a breast cancer screening or foregoing a mammogram is just not worth the risk. And breast cancer, like any cancer, early detection is key.
August of 2019, I was diagnosed with an aggressive form of breast cancer, specifically triple negative invasive ductal carcinoma.
Sydney Rosicki, stage 3 at 23. Within a few weeks, she was starting chemo, all while trying to cope with news she never expected. And if it wasn't for a self-breast check, she may not have caught it soon enough.
I came across something that didn't feel normal.
Self-checks, Dr. Kimberly Hart with DMC says, are often overlooked, but can make a huge difference in successfully beating this disease.
Every week I have patients come in who have found the lump themselves.
And during the pandemic, doctors like Hart noticed something alarming. Nationally, breast cancer diagnoses down 52% this summer. Breast imaging down 62%.
There is that difficulty to overcome the patient's fear of coming into a hospital setting. This is actually one of the safer settings for you to be in because everyone that comes in our door is screened. Much safer than going to a family gathering, shower, etc.
Dr. Hart says women starting at 40 should get annual mammograms. The fear of the radiation associated with them, she says, also shouldn't stop you from getting one.
Mammography, compared to some of our other modalities like CT and PET scans, are relatively low radiation. The benefits of finding an early cancer way outweigh the potential risk of getting a second malignancy from medical radiation.
Sydney, now 24, is in remission after 16 rounds of chemo and a bilateral mastectomy. She's become an advocate for self-checks and taking the initiative to seek help and treatment.
This is something that could happen to anybody at any time, and it's important to be aware of your body and what feels normal.
An important reminder there, and breast cancer does not just affect women, it can also affect men, although it is less common. The good news, Dr. Hart says locally they are seeing more women start to come in for breast-related visits than they did previously this summer, so that's positive news. We have much more information on our website, including how to do a self-check and important things that you should be on the lookout for. Just head to WXYZ.com. Reporting live this morning in downtown Detroit, Jen Shantz, 7 Action News.
Wow, just critical information to think that diagnoses are down 50%, and we know it's not because people don't have cancer, it's just that they're not getting screened for it. Jen, thank you for bringing us that critical information and those reminders.
A really powerful story. Thank you, Jen. All right, well, tonight, Walled Lake parents will learn more about the district's plan to return to in-person learning. Meantime, students will continue